at a place like Moffitt, because we're a referral center, a lot of times patients already have some information about what's going on. They've met with some doctors initially and sometimes even come up with a plan. Other times patients haven't had that conversation. So the first job for me is to figure out what the patient knows or doesn't know so that we're all starting at the same point. Obviously, things can get pretty complex in some cases, and doing all of that or trying to give all that information to a patient in one setting can be a lot for them to process. So sometimes in those complex cases, we sort of space things out as far as the plan so they're not too overwhelmed. But pretty quickly, once we're on the same page, then we start talking about their specific case, right? And that includes things like the size of their tumor, location, but also an important part is the patient's preference, right? What their experience in life has brought them so far, whether it's through family members, people they know who have had cancer, even if it's not the same cancer, a lot of those can influence what a patient desires from their outcome. And that also includes things like quality of life versus quantity, or both, obviously, and many times. Those are all the things that we try and get started at that first initial meeting. Part of my job has a lot of good to it. I love what I do. I love helping patients, and a lot of times I get to have conversations where I tell them, in fact, this mass is benign and you never need to see me again, and that's a great experience. But it also includes the other end of that, where there's difficult situations, and my goal is to be transparent. And I love being transparent when it's good news, but I also have the responsibility to be transparent when it's not good news. And I think that's an important part. Patients appreciate that honesty, although certainly none of the ones who get the bad news enjoy that. But I think it's important to make sure that they understand either the severity, complexity, because obviously my focus is on treating the cancer and taking care of the patient, but the patient has other responsibilities, family members outside, and those can be affected by these diagnoses too. So we need to not forget about that. So the first thing is to try and be your own best advocate. Obviously, you need to rely a lot on what the doctors say, and hopefully you trust those doctors. But I always tell patients, don't hesitate to get a second opinion. A lot of times in these situations, sometimes people's pride or the fear of hurting somebody's feelings, especially if that's your doctor or somebody you're newly seeing. But at the end of the day, it's you're the patient. You get to decide on what you want, and you should get as many opinions as you want or you can get. And then you need to figure out, obviously, which team you work with best. But never should you take the first initial answer. When you're dealing with something as serious as cancer, I think it's worthwhile to do due diligence. And it's also important to set up a support network. Sometimes cancer can be a very personal thing to patients, but sometimes that can be to their detriment, where they're afraid to tell their family, they're afraid to tell their friends. Again, no patient usually brought cancer on themselves, right? And so having that fear sometimes can limit that access to both emotional support, sometimes logistical support. So I encourage patients to start developing their own team. We'll certainly do that on the medical side, but doing that on just your personal side also goes a long way. Been doing this long enough that I've seen a radical change in the drugs that we have available, the survival patients are having, and it's really inspiring. And I feel fortunate to be at this point in my career to witness this all, because for a long time, if you look in the history books, there wasn't much done. And the field has changed rapidly now, and is good, I think, continuing to do that. Like much in our world with AI and other technologies coming forward, we're leveraging all those to really advance kidney cancer at a pace that seemed impossible decades ago. And so CAR T therapy, a lot of the new immunotherapies beyond the ones we already have, are really holding some promises, not just for kidney, but for other cancers. And being at a place like Moffitt, where we can learn from other people who studied other cancers, whether it's brain cancer, pancreatic, we can take the best ideas from that and apply it to kidney, and vice versa too, really allows us to not only improve kidney cancer patient survival, but all patients with cancer. Many of the patients who are here today are patients that I initially treated 4 or 5 years ago. And part of my job, obviously, because I'm always focused, tends to be on the newer patients, the ones who need surgery or just had surgery. And as a surgeon, sometimes we forget about the patients 5 years ago. And so seeing those patients come back 5 years after I've told them, you don't need to see me again, you're cancer-free, you're cured. But to see those lives go on after that, I don't always get to be a part of that. And so having that experience lets me know, that again, the ER visits, the hospital stays, all that has a means to an end. And the end is to watch people live the rest of their life cancer-free.